Welcome back to Nursing Manthra. Today, we are going to talk about something that confuses a lot of nurses aspiring to work in the USA. The fingerprinting process for NCLEX application when you are outside the United States. Before we dive into the specifics, let us quickly recap why fingerprinting is so important for the NCLEX process. Whether you are a nurse looking to work in the USA or pursuing licensure from a state board, the fingerprinting process helps verify your background for safety and security reasons. While you can do live fingerprinting if you are in USA, the process is a bit different if you are outside the country. So let's talk about what you need to do if you are in your home country and need to submit your fingerprints for NCLEX. When you are outside the USA, the fingerprinting process does not involve live scans. Instead, you will need to use a fingerprint card, specifically FD258 card. This card is used for collecting your fingerprints manually. We are calling it a standard FV1 FD258 fingerprint card form. This card you will find most of the agencies, those who are doing fingerprinting services, you will get from them. Or it is important that you get the right one, as this will be required by the nursing board to process your application. It is available in Amazon also. In that you can use two cards and you have to send two FD258 card to the concerned agency. Photocopies of fingerprint forms are not acceptable. The two fingerprint cards should be from two different fingerprinting attempts. The cards are compared to see which is better quality. This helps lessen the chances of a rejection from the FBI. That's why we are sending two FD258 fingerprint to the authority. Individuals may not fingerprint themselves. That means you cannot fingerprint by yourself. So fingerprints must be obtained from a law enforcement, like your police headquarters or fingerprinting departments are there, or other authorized fingerprinting agencies are there. So these two sets, you have to roll all the impressions of all 10 fingerprints and impressions of all 10 fingerprints taken simultaneously. All fingerprint boxes must be filled in. Exemptions must be noted. For example, if you are missing a finger, is annotated by placing an X on the card where the fingerprint should be. Once fingerprints have been submitted, no refund request can be granted from the authority. So what will happen to the fingerprint which you are sending to an agency like Identigo, Accurate Biometric? Make this fingerprint into digital format. They will send it electronically to the state police and FBI for the background check. The result will be forwarded directly from the FBI or the state police to the concerned authorities. Like if you are applying for the Illinois board, means to the Illinois board continental testing, or Texas board means they will send it to Accurate Biometric as well as the Texas board of nursing, like that. Same like other nursing boards. Here are the steps you will need to follow complete your fingerprinting process outside the USA. The first step is finding a trusted fingerprinting agency in your country. Different countries have different agencies that provide this service. So be sure to check if the agency can handle FD258 cards. You can check the website of the state nursing board or your licensing authority to find recommended agencies. Example, for Texas Board of Nursing, fingerprinting process is doing through Identigo. We have to make Identigo site payment around 39 USD. Then you will get payment receipt from Identigo. With this payment receipt, to FD258 card, passport copy and fingerprint forms from Identigo, you can courier to Identigo agency. For Illinois board, it is Accurate Biometric. They have different forms. They will send with the application form 258 card and all these forms. Payment details also we have to courier. So Accurate Biometric fingerprinting amount is around 67 USD. They will take through our credit card details which we have given. Step 2, we have to fill out FD258 fingerprint card. So once you find an agency, you will need to fill out your information on the FD258 card. This includes your full name, date of birth and all other essential details. Ensure that all the information is accurate and clear. You can check agency guidelines to fill the form. Your name in the nursing board and fingerprint card must be the same. If it is different name, even spelling mistake, also the card will return back to you. Some persons recently it is happened like last name and first name, it got misplaced. Then they returned the fingerprint card. As you know that if we are sending the courier from UAE and almost 400 dirhams for one time courier it will be. So if they are returning, again we have to send the courier again. So make sure that you are filling the information as exactly on the application form and your passport. If you want to print your name details and all, you can print also in the card. And always if you are using like a pen, you can use black ink. So please print clearly in the first, middle, last name field and all, same like passport and the board registration. Then signature of the person being fingerprinted. You must sign this section when your fingerprint are applied to the card form. It must be signed by the presence of the agent taking your fingerprint. Residence of the person fingerprinted. Card must be signed and dated by the agent taking your fingerprints. That is important. Then recent fingerprinted. You can write NCLEX application for registered nurse in Illinois board, like that. You can mention that. Then your date of birth. It should be month, date and year formatted. Okay, you can just check the instructions. If it is mentioned date, month, year format means you can do that one. But most of the cards it is month, date, year format. Make sure that you are mentioning these details correctly. Then your citizenship, you have to enter your country of your citizenship, your sex, like male or female, like that. Race, use the following race. Like if you white means W, we have to mention. I means American Indian or Alaskan Native. H means Hispanic. A means Asian. B means black. So appropriate one you can mention there. Then your height, enter the height in feet and inches. For example, 5 feet 5 inch. Weight, enter weight in pounds. For example, 140. Then eyes, use the following abbreviation for your eye color. Black means BLK. Blue means BLU. Green, GRN. Gray, GRY. Bro for brown. Hazel, HZL. For hair color, use the following abbreviations for your hair color. BLK for black color. Red color means we are mentioning red only. Then gray means GRY or partially gray also GRY. Then blonde means BLN. White means WHI. Brown means BRO. Bald means BLD. So your place of birth, enter your state, country of birth, or where is your place of birth. Your India means India, you can mention. Social security number, SOC. Enter the social security number if the person is already there in the USA, or if you have already SSN, you can mention social security number. But if you are outside USA and first time you are applying, you don't have SSN means you can keep that area blank. Once we fill the form, the next step is having your fingerprints taken. The agency will apply ink to your fingers and press them onto the card, one finger at a time, making sure the prints are clear and legible. The quality of your prints is critical, as poor quality prints could delay the process. Make fingerprint in 2 cards. Agency person has to sign and fill details about agency where the fingerprint has taken. Now step 4, submit the fingerprint card. That means you have to send courier to the agency. Once your fingerprint card is completed, you need to submit it to the appropriate agency or directly to the nursing board or licensing authority handling your NCLEX application along with appropriate forms. You have to send courier to appropriate agency as per your nursing board. Mailing address will be mentioned in the application form. Every state board of nursing in the USA has its own procedure for fingerprinting, and they may work with different agencies for this process. Some popular agencies include IDMEI and Gemalto, Identigo, Accurate Biometric. Be sure to check with your nursing board to confirm which agency is acceptable. Also, remember to keep a copy of fingerprint card of your records and make sure your fingerprints are clear to avoid delays. If your fingerprints are rejected, you may have to go through the process again, which could set back your NCLEX application. If you find this video helpful, make sure to hit the like button, share with your friends who might need this information, and subscribe to Nursing Manthra for more tips on your NCLEX journey. If you have any questions or need help with the fingerprinting process, you can contact Nursing Manthra WhatsApp number which is displayed here.